Hi, nice to meet you. I'm Dr. Wang. Yeah. What is your name?
Mark.
Mark. Okay. How can we help you today?
So I've got deterioration in both hips.
Okay.
I'm on the waiting list to have this one
Okay.
done.
Okay. So which side is more severe?
The right
side. And what are the symptoms that you feel?
So I have a very slight awareness just around coming down here at the moment, but only very slight.
Okay.
Sometimes I get stuck when I'm standing up.
Okay.
And the longer I'm walking on it, the worse it gets.
Okay. So right now, sitting there, do you feel it?
I'm just aware of it, but only at a very low level. Yeah.
So sitting there, what's the low level scale? 0 is nothing, 10 is maximum.
1.
1. Okay. What if you just lift your right leg up, sitting there, but flex your right hip like that? Do you feel it?
Yeah, it goes up. That goes up to about 3.
3. Okay. From a 1 to a 3. Okay. I think we can use that as a test. When it's what about, let me just do another test. If you do it standing up, what do you feel? What is it like that?
Yeah, that's probably a 4.
4.
Yeah,
Okay.
and it's kind of.
Then it comes a little bit more.
Yeah, it's coming around.
Okay. All right. So we have a couple tests that we can use. The first one we'll do is just sitting there, how it feels.
Yeah.
Number 2, we'll do it with this seated flexion, and then we can even test the standing flexion.
Yeah.
Okay. So right now, seated there, you said the main point is. Can I
It's
come?
just kind of in here.
Okay,
Yeah, just in the groove. Yeah.
What meridian is that?
Yeah.
Liver. Okay. Liver. Kidney would be more medial, right? Liver, spleen, stomach. Okay. So let's do this. Let's. Do you mind if we pull this up?
No, it's okay.
You have a nice tan there. You guys have sun here in this country? Sometimes. Can you hold that? Yes? He said, oh, yes. Okay. Let me go in there. Let's do one more. Just to find another angle on it. Actually, I'll just go ahead. That's what I'm looking for. Okay, so sitting there, do you feel anything? You can kind of wiggle your hips a little bit, if you like.
I kind of felt it release actually.
Okay.
For the first meeting.
Okay, good. So let's chase that a little bit. So when you're sitting there flexing now, where do you feel it most now? If that front part is clear, where do you feel it now?
It's kind of, I'm kind of feeling it all across here.
Okay. Down the leg here.
Yeah.
From here, would you say?
Yeah.
Tracing a line to here. Does it go to the knee? Is that where you feel it?
There's so much going on that it's.
Oh, okay. Okay,
Yeah,
that's okay.
Yeah, probably there's now the most intense.
Okay, more in there. Okay.
Yeah.
So I'm going to do a couple more points then to try to cover both this area and this area. Okay. Am I hearing you correctly?
Yeah.
Okay.
Yeah.
So let's do. Here. Oh yes.
Yeah.
I saw your
Yeah.
eyebrows furrow. Yeah. And then let's check.
That's all right.
Also, oh, that's all right.
Yeah.
Let me find the right meridian. This one? A little bit? Yeah. Okay, let me go distal, possibly. What about in here?
Yeah.
Okay. So let me just do 3 then, that cover those. And do you feel like it's muscle? That's
Yeah.
okay, muscle tissue. This guy's on the right. It's okay. Let's relax for a moment. You know what we should do? Let's have you stand up just to kind of move it a little bit. Okay. And then take a few steps just to loosen it a bit.
Yeah, that feels great.
That feels great. Okay. All right. You just needed to take a walk.